You have to turn it on, and then when you're done.
Good afternoon, everyone. I am Jackie Spear. I chair the Military Personnel Subcommittee. We are here very interested in hearing from all of you. We have an overflow crowd on the outside, and we're going to try and accommodate them at another committee room so they can at least hear what is going on in here. By virtue of you all being here, you underscore the fact that we have an issue that has not gone addressed appropriately, and you have our attention. In reading the statements of a number of you who are going to testify, I was particularly struck by one of the service members who said, as service members, I was willing to give up my life for my country. But families can't be afterthoughts in this process. And I think that says very powerfully what many of you are probably thinking, that somehow the families are being taken for granted and not being provided the services that they are both deserve and are required to have by law. We are here today to address longstanding issues impacting military families. Throughout my time on this subcommittee, and especially since becoming chair, I've heard alarming complaints from families and advocates about the efficiency and efficacy of the EFMP. The department and services have been far too slow to respond, treating this as some sort of niche issue when it has significant readiness and retention impacts. The fact is, parents focused on finding appropriate care for their kids will be less focused on their jobs. If we make them choose between their families and jobs, they will choose their families, as they should. And I don't want to hear that this problem is new or novel. Major documented issues in EFMP go back years, if not decades. I'm deeply skeptical that the program has improved over time. The services violate both law and DoD policy when they fail to ensure family members receive the medical and administrative support required under EFMP. Recent public reporting showed that families have a hard time navigating the program, that information in the system isn't accurate, and matches aren't consistently made. A 2018 GAO report showed that a lack of common performance metrics makes it impossible for the military to properly verify these claims by assessing coordination and family support. The news reports and letters I've seen on this issue are confirmed by recent firsthand experiences shared with me and Ranking Member Kelly. Several months ago, we traveled to installations in the Pacific Northwest, where we repeatedly heard about similar struggles that family members have with the program. The program is supposed to ensure that proper medical services are available for enrolled family members before they are assigned to a new duty station. Yes, we heard over and over that when families arrived, the proper services were not available. I can only imagine the nightmare of completing a cross-country move, starting a new job, and then having to struggle to get your kids the support they need. This could in part be because requirements or provider availability haven't been verified. That's no excuse and undermines the priorities that we ostensibly give to these programs. We also heard stories of families having to fight their own legal battles with state and local school districts for services that schools are legally required to provide with no legal support from military services. Families should not have to advocate for themselves if the law is on their side. And when this subcommittee convened to hear about the challenges facing enlisted spouses, we heard repeatedly that not only are services insufficient, but that some eligible families don't even sign up for EFMP because the stigma is considered a career killer. That's unacceptable. We're always going to have situations where kids and families need a little extra support. That reputation should be four-alarm fire warning for program implementers. These are just three of the common concerns we've heard. Without changes to the oversight and policies from DoD and the services, I worry these types of issues and many others will continue to plague our service members and their families. We owe them more. Today, we will be joined by two panels. The first will consist of representatives from military family organizations that advocate for families on these issues, as well as two parents who have struggled through this system and also advocate for other families. On the second panel, we'll have DoD and military service officials responsible for the oversight and implementation of policies, as well as GAO, to discuss their report. What I would like to hear from the witnesses today are solutions to the problems, some of which may have been identified by GAO but have been slow to be implemented. Others may be novel that we've never heard of before. I would like to discuss what else we can do collaboratively to improve and raise the program to the world-class level it needs to get to. I would also like to know what the services do to educate and promote the program and how the services combat any associated stigma. Before I introduce our first panel, I'd like to offer Ranking Member Kelly an opportunity to make his opening remarks.
Thank you, Chairwoman Spear. First of all, I want to say people, more specifically, and families are our most precious commodity. And as a warrior who's gone down range, our warriors and their families are here to fight and win our nation's wars. Warriors can't do that if things aren't properly taken care of at home. They can't focus, they can't do the things that are necessary if they can't be 100% sure that their families are being taken care of at home. They can only focus on their mission if they know everything home is well. And today, I think our EFMP, Exceptional Family Member Program, is not making sure that our warriors have that peace of mind. It's important that they have that peace of mind. There are many things that we can do, and I'm looking for hearing solutions. But I thank each of the witnesses here for being here today. I thank you for telling your stories. But I want to hear real solutions, and I want to hear how to get it right and to get it right now. Our families are too important to have a solution that is in the future. We have to start making positive strides immediately. Let me start by saying our military families are a vital component, maybe the most important component to overall readiness to the armed forces. Our military families endure deployments, training cycles, frequent moves, and many new beginnings. Our military families are challenged in so many ways, yet time and again, they find a way to succeed and try to make the best out of any situation. My hat is off to all of you. Thank you. Now let's think about the other side of the equation. If our service members are deployed and away for training, they will not be fully effective if they worry about what's going on back home. When service member knows their family's taken care of, they're more ready to focus on the mission at hand. EFMP is about readiness. When we think about EFMP, it's important to understand the scope of those impacted. At last count, there are over 103,000 sponsors and over 139,000 family members across DoD that are in EFMP. That means roughly 8% of the military and 9% of the family members are enrolled in EFMP. The Exceptional Family Member Program is charged with taking care of those military family members with special needs. The program was established to ease the burden of finding specialized health care providers, school systems with dedicated support services, and community support assistance. It is also supported to assist service members in the assignment coordination process. We know what the program should be doing, but is it carrying out its mandate? This past October, Chairwoman Spear and I hosted a roundtable discussion with enlisted spouses on financial literacy and military family support programs. The discussion quickly evolved and became consumed with challenges surrounding the Exceptional Family Member Program. I think some of you on panel 2 were here for that discussion. We heard repeatedly about issues with the assignment process, access to medical service, and a perception by a few that enrollment in EFMB would be a career killer. We wanted to understand this at an installation level, so in November, Chairwoman Spear and I traveled to Joint Base Lewis McChord and had several meetings with spouses and service members. In every one of those meetings, we again heard about challenges with EFMP. One of the comments that stuck with me came from a spouse that said, "Why would they move our family from a duty station where we had the established health care, education, and family services that we needed to a duty station where we were challenged to find any of these things?" It's a good question. As I prepared for this hearing and read some of my witness statements, I scratched my head even more. Some of these issues have been around for a long, long time, and things don't seem to be changing. I'm looking forward to hearing the perspectives of EFMP from Panel 1. Then I want to understand from Panel 2 how DoD and the services are addressing these EFMP issues and the roadmap forward. Once again, I want to thank our witnesses for their dedication to our military families and our chairwoman for having a hearing on this important topic. Thank you, Chairwoman.
Thank you, Ranking Member Kelly. Each witness will have the opportunity to present his or her testimony, and each member will have an opportunity to question the witnesses for 5 minutes. We respectfully ask the witnesses to summarize their testimony in 5 minutes or less. Your written comments and statements will be made part of the hearing record. I ask unanimous consent to accept the following submitted additional written testimony from the Military Special Needs Network, the National Council on Disabilities, Executive Summary on the United States Marine Corps Exceptional Family Members, and TRICARE for Kids Coalition into the record. Without objection, so ordered. Let's welcome our first panel. First, Ms. Kelly Ruska, Governmental Relations Director for the National Military Family Association. Ms. Karen Rudiswelli, Director of Health Affairs for Military Officers Association of America. Dr. Becky Porter, President and CEO of Military Child Education Coalition. Michelle Norman, Navy Spouse, 2019 Armed Forces Insurance Navy Spouse of the Year, co-founder of Parents for FAPE. Austin Carrig, Army Spouse and Special Needs Advocate. We welcome you all here today. All right, please begin.
Madam Chairwoman, Ranking Member Kelly, and members of the subcommittee, thank you for the opportunity to present testimony concerning the Exceptional Family Member Program. We appreciate your recognition of the service and sacrifice of military families, as well as the unique challenges facing families who have a child or other family member with special needs. Your response through legislation to the ever-changing need for support has resulted in programs and policies that have helped sustain these families through difficult times. Military families complain EFMP assignment coordination is not thorough. Some say they are sent to areas with insufficient medical or educational assets to meet their needs. In other cases, providers exist, but long wait lists preclude access. This seems to be a problem for families with children in the autism spectrum at Joint Base Lewis McChord. Many families being sent to JBLM report long wait lists for therapies, even with the opening of the Center for Autism Resources, Education, and Services. We ask Congress to require DoD to develop and publish performance metrics to evaluate assignment coordination effectiveness, to include evaluation of capacity of the available medical services and therapies, and not just a yes-no availability. Our association believes there needs to be more transparency in the assignment coordination process. Assignment coordinators need to provide more explanation to service members when they're not screened for an assignment. It's not uncommon to hear from families that they did not screen for an overseas assignment, but they know someone else with a similar diagnosis in their desired location. There are many reasons why families could be denied, possibly that healthcare specialties at capacity or a provider has just recently transferred from the duty station. Without a proper explanation, the family makes assumptions and then present those assumptions as fact. Service members also need to be more transparent in the assignment coordination process. A recent report on the well-being of military families noted families enrolled in the EFMP expressed concerns regarding stigma surrounding special needs family members and military career advancement. Some family members don't enroll their family members in EFMP, even though enrollment is mandatory for active duty service members with a family member with special needs, because they are concerned it will hurt their career progression. Some service members have moved their families overseas without command sponsorship because they were told there wasn't adequate medical or educational services in their gaining location. While service members may not be able to have it all, open communication may allow them to have a long and satisfying military career while their family has access to the proper educational and medical supports and resources along the way. A 2018 GAO report on EFMP indicates each service uses various mechanisms to monitor how service members are assigned to installations, but the report contains no details on how the individual services are monitoring assignment coordination effectiveness. We agree with GAO's recommendations that the Office of Special Needs develop performance metrics for assignment coordination. Specifically, OSN should develop common assignment coordination performance metrics across the services. Metrics should include measures of military family satisfaction with the assignment coordination process focused on the ability to obtain necessary medical care at the gaining installation. Metrics should track compassionate reassignments, off-schedule PCS moves due to inadequate medical resources at the gaining installation for EFMP families approved for that location. Compassionate reassignments of this nature indicate system failure and should be monitored to identify and address process breakdowns. Metrics should be reported on the installation level to provide actionable information. While our association and military families may be frustrated with the slow pace of process and service improvement, it is important to note that DoD and the services offer many services and supports to help our special needs families successfully navigate military life. We appreciate the help Congress has provided over the years and look forward to continuing to work together to ensure the system works for everyone.
Chairwoman Spear, Ranking Member Kelly, and members of the subcommittee, thank you for hosting this hearing on the Exceptional Family Member Program and inviting me to speak on behalf of the Military Officers Association of America and the families we serve. We appreciate this opportunity to speak about EFMP with a focus on access to medical care. The EFMP is an important tool for ensuring military families are not sent to locations that lack necessary medical and educational services for their special needs family members. This topic is especially important given recent study findings by the Children's Hospital of Philadelphia Policy Lab that indicate military kids are 40% more likely than civilian kids to have at least one special health care need. Policy Lab's research also found that military families reported worse health care access and lower quality care than their civilian counterparts. Surely some of this is due to challenges all military families face with reestablishing care after repeated PCS moves. However, we also know there are numerous issues with the military health system and EFMP that must be addressed to narrow these gaps in access and quality of care. Some EFMP families report that the medical screening process does not always work as intended, and families are sometimes approved for areas that may have providers but not appointments, or at least not without a long wait list. EFMP medical screening must not only identify providers at the gaining location, but also better determine actual appointment availability. While critical, improved medical screening alone won't address gaps in care. Current TRICARE Prime policy requires families to PCS before they can transfer their TRICARE enrollment, schedule an appointment with the new primary care manager, get specialty care referrals from the PCM, and then wait for those referrals to be processed. Only then can families contact specialty providers at their new location to make appointments. This means some EFMP families report a 1 to 2 month gap in care before they even get on specialist wait lists. This process could be streamlined and disruptions in care minimized by allowing families to get specialty care referrals for the gaining location before they PCS. Although not part of EFMP, another important program for military special needs families is the TRICARE Extended Care Health Option, or ECHO. Congress established ECHO as a substitute for state Medicaid waiver services that often have wait lists and are unavailable to mobile military families who never reach the top of the list before they move on. The current ECHO respite level of 16 hours per month disadvantages military families relative to Medicaid waiver recipients who get on average of 58 respite hours per month. We urge DoD and Congress to increase ECHO respite to bring it on par with Medicaid. EFMP families face many challenges in navigating military life while also caring for their special needs family members. We appreciate that Congress and DoD established EFMP to ensure families can access needed medical care, but it is falling short of serving families as intended. With the Policy Lab study, we now have evidence that military families, and particularly those with special needs, face greater problems with access and quality of care than their civilian counterparts. These problems must be addressed to ensure military health care is an unmitigated benefit, not another sacrifice to add to the many that service members and their families already make in support of our nation. We appreciate the subcommittee's attention to these issues and look forward to answering your questions.
Thank you. Ms. Norman?
Chairwoman Spear, Ranking Member Kelly, and members of the Military Personnel Subcommittee, thank you for the invitation to be here today.
Order.
The Military Child Education Coalition is a globally recognized nonprofit that works to ensure inclusive, quality educational opportunities for all military-connected children affected by mobility, transitions, deployments, and family separation. Given our mission, we're not infrequently contacted by family members who have concerns or questions about their children's education. In recent months, it has come to our attention that an apparently growing number of military-connected parents of children with special needs feel that the basic education needs of their children are not being adequately or appropriately addressed by the schools they attend. Moreover, their efforts to garner assistance through the Exceptional Family Member Program or the Military Installations School Liaison Officers are largely ineffective. Several families reported to us that the EFMP is broken, clearing them for assignment to locations where nearby schools do not have the resources to meet their children's educational needs. According to their reports, many families undergo undue emotional and financial stress as a result. A theme from many EFMP families is that they have to repeatedly fight for basic special education services. What is especially difficult for these families is the fact that even if they are able to eventually get some modicum of appropriate support for their children with special needs, it might be just as the service member receives orders to move, and the process starts all over again in a new state, with a new school district, and new special education processes and resources. The interruption in services and instruction and the prolonged period to reestablish an appropriate individualized education plan take precious time, during which children with special needs may regress and ultimately require even more support. This paradigm, compounded over multiple PCS cycles, adds up to years of lost learning and development. Some families are deciding to remain at a location where they've established qualified individualized services while the service member PCSs to the new duty station. This decision puts additional stress on the family, much as separation from a deployment would, and forces the spouse to manage all of the requisite meetings and appointments, not to mention the needs of the other children in the family, without the benefit of the service member being present to assist. Other families are deciding to school their children at home, where they feel they can more adequately control their children's individual instruction, medical appointments, and academic schedule. The spouses in these families take on an incredible burden when they feel the service member has been assigned to a location that clearly cannot meet their needs, and not all spouses have the necessary skill set, education, or financial means to accomplish homeschooling responsibly. While we have heard from some families that there are installations where EFMP works well and school systems work proactively to meet the needs of their children, we've heard far more reports of varying standards and poor execution of the EFMP. School liaison officers are often not trained or lack the time to adequately assist in accessing the necessary services for children with special education needs. As a coalition, we want to partner on a collaborative solution. We think that solution should include all of the stakeholders. Among the other recommendations in our written testimony, we suggest a coordination that seems to be a major issue. We recommend a person at each installation be identified with the sole mission of providing liaison among the school liaison officers and EFMP coordinators, not a handout and not a website, but a hands-on solution. I'd like to thank the members of the subcommittee for your interest in this very important issue, and I look forward to your questions.
Thank you, Dr. Porter. Ms. Norman.
Madam Chairwoman, Ranking Member Kelly, and distinguished members of the subcommittee, thank you for the opportunity to discuss EFMP and special education challenges our military families face. I'm a proud Navy spouse of 25 years. My husband Cassidy currently commands the forward-deployed USS Mount Whitney. We have moved 10 times and have spent over 3 years geographically separated. Our children and I were not able to move overseas with him due to our EFMP status. In 2003, our lives changed drastically when my daughter Marissa was born prematurely at 27 weeks, weighing 2 pounds 3 ounces. She lived in the NICU for 8 months and has 21 diagnosed disabilities. Providing opportunities for Marissa, including those required by federal law, has taken an incredible toll on us, both emotionally and financially. In 2014, Marissa entered Virginia Beach City Public Schools with an individualized education program known as an IEP. In the first 30 days, goals and services were removed. The school continued this pattern of minimizing Marissa's disabilities and telling us that everything was fine. Our concerns were discounted. This is common for many EFMP families, to be gaslighted. When we pushed back, meetings became hostile, not collaborative, and worse, the school district was not allowing her access to the education as outlined in her IEP. Imagine how hard this was for Marissa. She regressed socially and academically, failing all benchmark testing. To make matters worse, Cassidy was out of state for 22 months. Meanwhile, school officials kept asking when we would receive military orders, following the same pattern of school districts waiting us out the military families all across the U.S. have experienced. Stressed and exhausted, I called the EFMP case manager. She told me that they could not advocate for families. Similarly, the parent liaison couldn't help, the SLO couldn't help, the VDOE couldn't help, and the JAG couldn't help. Only the Marine Corps has attorneys for their EFMP families. So this is the problem. When we know a school is breaking the law by not implementing an appropriate IEP, how do we hold a school accountable? Webinars and military one-source information do not hold any weight in an IEP meeting. If parents speak out publicly, they and their children suffer from reprisal from the school district. We knew we needed to try to do the right thing, not just for us, but for others who do not have a voice. We borrowed money, hired a special education attorney, and placed Marissa in a private school, a decision that improved her life significantly, even though she had to repeat 5th grade. We won our first due process hearing in 2016. We won an appeal to the 4th Circuit Court in 2018. And we won numerous VDOE state complaints in between. Yet, Virginia Beach refused to comply with the orders from VDOE, a hearing officer, and a federal district judge. A few days after Christmas last year, right before Cassidy was to leave for a 15-month overseas deployment, Virginia Beach sued my daughter to get her back in public school. The Individuals with Disabilities Education Act was now being used as a weapon against my family. Marissa has now testified twice. It will literally take her years of therapy for her to heal from the trauma and anxiety the school district created. But this story is not just about Marissa. It's about the tens of thousands of military families in EFMP. If, after spending over $220,000 in legal expenses out of our own pockets and winning all legal decisions, the school district with deep pockets of taxpayer money continues to violate law with impunity and without penalty, how can an enlisted service member even begin to fight? Our deployed service members are distracted and worried about their children while their spouses are being forced to fight an unfair fight for education already mandated by law. We're too burdened, too scared of reprisal, too tired, too spent on deployments, and too broke to obtain the resources our children need. That is why we need data and legislation to universally fix EFMP. Recognizing we need more data on special education, we worked with congressional leaders to insert language in the NDAA 2020 to mandate DoD study those challenges. After presenting at the Congressional Military Families Caucus Summit last October, 3 military spouses and I designed a special education survey. The results confirm that special education is an unspoken challenge for military families, illustrating systemic problems that transcends all ranks and all services for military families at duty stations across the world. At the request of the Military Family Caucus, we drafted the Promise Act to provide safeguards for military children with special needs, provide accountability and transparency of taxpayer dollars, and support military families forced to pursue due process. We love our teachers, and we all agree that more funding will help. Yet the survey shows that providing more impact aid to EFMP-centric school districts years ago did not help. Ironically, those schools were among the worst offenders for special education violations. We have to establish accountability and transparency. In conclusion, access to reliable special education resources affects and touches all citizens in our society, and the lack of access impacts thousands who serve this great country. Military families and children are suffering, which in turn is severely impacting military readiness and retention. With the Promise Act, we can fix this. Let's do the right thing and fix it. Thank you.
Thank you. Ms. Carrig.
I would like to thank Chairman Spear, Ranking Member Kelly, and members of the subcommittee for this opportunity to speak before you about the EFMP program. My husband has been active duty for 17 years and is now a first sergeant in the Old Guard. During his career, we've been through 5 PCS moves, and my husband has deployed and gone to training away from our family more times than I can count, often while our children were in crisis or in the hospital. It was at my husband's 4th duty station while on a compassionate reassignment for our son that we brought our daughter Melanie home. What should have been the most exciting time of our lives turned into a nightmare. Melanie was born with Down syndrome and a congenital heart defect that would lead to her hospitalization just 3 days after joining our family. We learned that in order to survive, she would need open heart surgery at 8 weeks old. The process to get her covered by TRICARE would be long and protracted, and to do so, we'd be forced to drive to the nearest Army Guard base to complete the paperwork, then wait for it to be processed. The process could not be expedited, and our daughter's surgery could not wait. As we met with the hospital's finance department, they explained that we needed to put down a 10% deposit to proceed with surgery, and the deposit was $100,000. Ultimately, the cost of saving my daughter's life was $1 million, and time was not on our side. Someone suggested we explore Medicaid as an option, and I'm thrilled to share with you today that thanks to Medicaid coverage, she had a successful open heart surgery. For any family, this alone would have been the most stressful event of their lives. However, it was while Melanie was in the hospital recovering that we were told my husband had 2 options. He could move our family for his upcoming PCS or voluntarily separate from the Army. He begged for an alternative, explaining that he deeply valued his military career and most certainly did not want to separate, but that our daughter simply could not be discharged so quickly after surgery. The response he received is seared in our memories. While sitting at her bedside in cardiac ICU, he received a phone call from Army Branch. The room was full of doctors and morning rounds, and my husband was told, maybe you can return that one and get a different one once you're there. In regards to our newly adopted daughter. The conversation happened on speakerphone, and the entire room went silent upon hearing those words. This is the moment we realized our family meant nothing to the military. We reached out to the gaining station's EFMP office only to be told there was nothing they could do. All of our children's needed services were available in the local area, and 3 weeks later, I was forced to discharge my daughter against doctor's advice because we didn't have the finances to support 2 households. Once we arrived, it became clear that although services were available in the area, the wait lists were over a year long for some specialties. Our first stop to the EFMP office was where I begged them for help. I remember explicitly asking, you said there was care, you know there's a 28-day standard. Where did you find the providers you did to bring our family here? The FMP provider replied, it's not our job to check or track wait lists. We just look at the TRICARE website to see if a provider is listed and taking new patients. It took us 2.5 years of fighting and 2.5 years of heartache and 2.5 years of constant stress and 2.5 years of delayed and inefficient care for our children before we were able to get out of there. In 2015, my husband was granted a compassionate reassignment to the Metro DC region. Here, my family has unequivocally received better medical care than anywhere my husband has ever been stationed in his career. But that means we access care across 3 states and the District of Columbia. The move from an education standpoint has been flat out dismal. In the 5 years since we arrived here, we've had to sue the local school district 3 times on behalf of our sons, and we are currently in the middle of a due process complaint on behalf of our daughter, as well as 2 federal complaints because she's been excluded from school for 2 years. Earlier, I mentioned my daughter had surgery covered by Medicaid, but that's not where her need for Medicaid ended. Despite having ECHO, which was supposed to be the military's answer for things not covered by TRICARE, Despite having ECHO, which was supposed to be the military's answer for families like mine needing Medicaid, we still rely heavily on it for things not covered by TRICARE, such as a continuous glucose monitor that alerts us to dangerously low blood sugar levels that can cause long-term neurological damage. Secretary of Defense Esper recently said, I understand well the sacrifices our service members and their families make to protect this great country. This is why I'm committed to taking care of families and ensuring they have the resources they need to thrive. One thing I know beyond a shadow of a doubt is that your military members living with children on EFMP are far more resilient than those that are not. The skill set to remain calm under constant pressure while juggling life or death decisions is a skill we know the military needs and our families practice daily. I wish I could say that my family is alone in the things that we've experienced and the opportunities that we've lost, but I've spent the last 7 years advocating for families like mine, and I'd implore you to read my written testimony about Willow, whose father was stationed at an installation without a required neurosurgeon and has suffered loss of vision in one eye because of it, about the Olson family, who's dual military and has been forced to initiate the retirement process and separate their twins to assure appropriate and timely medical care. I could continue on for hours with the stories, the families I've assisted, the families who the military has failed. Why does the DoD continue to fail on issues like this, whether it's housing, where we allow contractors to risk the health and well-being of our families, childcare, healthcare, or special needs children?
Thank you all, in particular Mrs. Norman and Mrs. Carrig, for those profound and gut-wrenching words. No, I don't actually know where we should start. And let me disclose as well that as a mother of 2 children, one of my children had an IEP. So I'm very familiar with the process. She was diagnosed with auditory processing disorder, ADHD, and OCD. So while I haven't traveled the same roads that all of you have traveled, I have some experience in knowing what the process is like. It would seem to me, based on the testimony of our 2 mothers here, that what we need more than anything are dedicated legal personnel at each base that can provide the legal advice and counsel for families as they try to get the IEP for their children that they deserve. Do you have any comments on that?
I agree with you, Chairwoman Spire. The Marine Corps does a really good job. They do offer special education attorneys on both coasts, and they offer extensive training to their EFMP case coordinators as well, who are able to attend IEP meetings and work in conjunction with the special education attorneys. I think that their model exists, and we do not need to reinvent the wheel. We just need all the other branches to follow their lead.
Thank you. Ms. Carrick, do you have anything that you'd like to add?
I think it's important to remember that even if we have the attorneys in place, that's a great first step, but schools aren't following the law because they know they cannot follow the law and be allowed to get away with it because we're going to be moved. There needs to be something else in place that holds them accountable. They're getting impact aid. There's no reason that aid isn't going towards our children with disabilities. And they're not telling us where it's going. Nobody knows where the money that they're receiving from military children is actually being used in the school districts. There should be accountability.
I would agree with that. Dr. Porter, you referenced a study that was done that showed that the children of military families were 40% more likely to have at least one special health care need than the civilian population. Can you expand on that further?
Is that you?
Yeah, that was
Excuse me,
actually me, yes. Last summer, the Children's Hospital of Philadelphia did a research study using a panel database called the Medical Expenditure Panel Survey, I believe, that asks families a variety of questions about their access to care, their health conditions for their children. It also asks what coverage they get from where their source of healthcare coverage is. That's how they're able to pull out military families as identified by their TRICARE coverage. And in that survey, it was 40%. It was a 40% higher rate of special needs among military connected families versus civilian families or families who did not get their insurance through TRICARE. We speculate that, there's a lot of challenges to getting medical care when you're moving regularly, and that contributes to some of that reporting in terms of access challenges. But we're also aware of many issues within EFMP and the military health system that can contribute to access problems, like appointment shortages in the direct care system, the many assignment process issues that we've talked about here today.
When we were visiting in the Pacific Northwest, what kept coming up were the number of families with children with autism. Mm-hmm. Have there been any studies that address the incidence of autism? Is it equal to what it is in the civilian population, or is there a higher incidence?
I am not sure about autism specifically. Behavioral health diagnoses are 35% more likely in military families versus civilian families per this research study that was done, and that does include autism as part of the behavioral health diagnoses.
Can you define what else is in behavioral health?
Things like ADHD, anxiety, adjustment disorder.
All right, thank you. Dr. Porter, you indicated that in your experience, you have seen some EFMP programs that work well. Can you identify any specifically?
Madam Chairwoman, I cannot identify them specifically. The way that they were communicated to us was mostly in the way of a family saying, we had everything set up, finally, and then we had to move. They did note that there were some places where it worked better than others, but they did not specify where they were.
All right, and finally, let me just ask about these EFMP coordinators. Are they sufficiently educated in their roles to provide advice, or are they basically just railway conductors sending people from one location to another?
Our association has heard a mixed review of EFMP coordinators. I think, unfortunately, like many services provided, that sometimes the assistance that's provided is only as good as the person sitting in the seat. So we've heard from families that they've received outstanding service from individuals at installations across the country. I want to say Fort Bragg comes to mind, that they have a systems navigator there that we've heard a lot of really positive feedback about. But then there are others that find that the path of least resistance is, it's easier just to say, oh, I'm sorry, here's a website. And so there's some inconsistency there. I think that there are some really dedicated professionals out there that truly want to help families. I think it's just, again, inconsistent.
All right, my time's expired. Ranking Member Kelly.
Thank you, Chairwoman Spear, and thank you, witnesses, and thank you for telling us your story and more importantly, telling us what's wrong so that we can try to figure out what to do to make it better. The first thing, Chairwoman Spear, is it's shocking to me that we have public school systems that are denying care against federal law, and that's outside of our purview, but we need to figure out something to make sure we can enforce that.
The gentleman yield?
Yes, ma'am.
I was also taken by one of the comments that they will, quote, wait you out, because they know you're a military family, so if they wait long enough, you will just be PCS somewhere else, and that appears to be one of the techniques that's used. Go ahead.
I think you and I can be very bipartisan on that issue.
I think we can.
Second, the Marine Corps has a system that is at least partially working and doing things with the legal aid, okay? And I think the DoD folks in the back need to be listening to that. When we have something that works, we don't need to reinvent the wheel. We need to use it and apply it. So that makes it better for everyone. So I just encourage DoD to think about looking at what the Marine Corps is doing, because it's right. As to the panel, and this is any of you, are you aware of any civilian programs that are similar or on the same level as EFMP that are working right, or that we can get good ideas from or develop, or to see how to make it work better?
I would just say, and I focus on medical issues, I would say there needs to be an improvement to medical case management so that it's more akin to what you find in high-performing civilian hospitals. In civilian children's hospitals, if a child is brought in as an inpatient, the case managers or social workers proactively approach the families and start asking, have you thought about this? Have you thought about this? Do you need a letter stating the condition of your child so that you can get some time off work? Do you need our support in any way? And they start proactively raising the issues. I think that is lacking within the military system. The case management is fragmented. There is no medical component to case management within EFMP. So once EFMP identifies the family member and once they're screened for the assignment, their responsibility on the medical end is over. And so if the family encounters problems once they get to the new duty station with medical issues, there really isn't an EFMP resources to help them. So I would recommend highly improved case management in line with high-quality civilian hospitals.
Thank you. And for our two service members, I consider you servicemen. When you're a spouse, you guys serve as much as the guys in. Do you think that the military family should be able to opt in and out very easily? Because there's certain jobs and key assignments that you want to take, and you're willing to opt out because there's a sacrifice, but it means a promotion later. And sometimes you want to opt back in, but it should be the service member. Do you think maybe it should be the service member's choice to opt in and out, and not necessarily? Because once you're in now, you're in, and many times it costs you assignments, which could be career progression assignments.
So I think that can be tricky. I think that it's not a matter of opting in or out. I think it's a matter of offering a family an assignment together with your family, or offering your family an assignment that perhaps you couldn't have with them that you can move on with your career. Because it's extremely difficult to get out of EFMP. It's a lot of paperwork. If a child dies, a family has to go through a process to have that child removed from their EFMP packet once it's expired. So it should be a matter of assignments. Here's an assignment with your family, here's an assignment without your family, and you can choose which one you want.
Absolutely. I think you answered my question, and I agree wholeheartedly. It shouldn't be that hard to get out or to waive or do something. It shouldn't affect your whole career when the circumstances no longer apply. A child is emancipated, or you decide there's something different. What should DoD focus on first in the EFMP program to make immediate gains?
I think the first thing we should do to make immediate gains is to standardize EFMP among the branches. That is definitely number one. And I think when you do that, we can start taking a look at the special education piece. And we just need to force school districts to follow the law and hold people accountable. Federal funding needs to be transparent, and it needs to be auditable. This is federal funding. So we can start working towards that solution with passing the Promise Act and looking at those initiatives to bring in that transparency.
I agree with the across the spectrum. We don't need to have 4 different systems. And number 2 is I think we can look maybe DOJ or somebody is listening right now, because if all the school systems around these places are doing the same thing, maybe we need to turn up the heat from this level so they understand we mean business. You're going to take care of our soldiers, sailors, airmen, and Marines and their families and their kids. And with that, I yield back, Chairwoman.
Thank you, Mr. Kelly. We actually have to look in our own house as we address this issue, because we don't fund the IDA program at the level we're supposed to. I think we only fund it, and maybe Ms. Davis can respond to this, at 40%. So school districts are underfunded by the federal government for these services, and so they look at ways to cut costs. We might even want to look at this additional funding we give school districts near bases and give it to the families to use that money for personal services in lieu of that, as maybe another way of looking at it. Ms. Davis, you're recognized.
Thank you, Madam Chair, and thank you all for being here and sharing your very compelling stories and your background and working with this for such a long time. It saddens me because we actually had worked hard as we went into Iraq and Afghanistan to try and be far more responsive to families, because initially there was really no there when it came to the kind of resources and I think the culture of acknowledging the critically important role of families and readiness, as well as just about everything else, when it comes to our national security. What I wanted to try and sort out a little bit, and again, I was a school board member as well. And so I know how hard and yet how, I don't want to say difficult, because everybody knew what the job that had to be done. And yet, I think our schools, because we talk about 40%, we're supposed to be funding special needs at 40%. We're nowhere near there. And that's part of the thing. So we got to look in the mirror on that too. And I've always been struck by, I can't think of a more bipartisan, important issue for members of Congress to deal with. And yet, we fall short continually. And that puts it all on local school districts. But I want to ask you a little bit about that, because you seem to be saying, and I think it's a very important thing to try and bring attention to, that there's resources. We don't have the resources, whether it's an impact aid or whether it's generally the amount of money that goes towards special education. So that has to be changed. But culture also plays an important role. And that whole idea that somehow people feel that their careers would be impacted if they come forward and say they need to take advantage of any policy that's out there that they can access, that hurts them. So if you could just, whoever wants to respond to this, I mean, how big a role does culture play? And that seems like something that we absolutely have to be able to address. You want to, whoever wants to start?
I will. I think that the EFMP and the Office of Special Needs tries to reinforce that enrollment in EFMP is not going to be a career killer, and tries to address those concerns. But I think the problem is that we also, it's one thing to say something, but then it's another thing to get to the deck plates or to the service leadership, and they have to model that as well. And it's our experience that always hasn't been the case. We were contacted 2 years ago by a loop of an Army general who had been told that he wasn't going to be getting an assignment because he had a special needs family member and was going overseas, and his aide was trying to figure out how they could get around it. And I was struck as I talked with him that, here's an opportunity for a leader to be modeling behavior for their service members and to say that this is important and you need to address it, and it's not a career killer, and they weren't doing that. And so I think it takes more than just the Office of Special Needs and the services to say something. That behavior has to be modeled by the services and the leadership as well.
And I don't know whether, and I want to ask this of the DoD as well, is how much time and effort is spent in whether it's orientation or whether it's really learning seminars to help educate our leaders about these issues? Because it may be that in many cases they don't get it. They get it if they've had that experience, but if they haven't, they may not. So that's something that we need to look at. And we face this in sexual harassment, sexual assault issues, we can't guarantee that everybody's going to come out of an experience utilizing the information that they should have received, but you can at least expose them. And I think that that's something that we need to take a harder look at. And you might have had some experience with that and can help us out, because that educational piece is really quite important. I'm pleased to hear that and I know that the Marines are doing this better. I think that what we have to do is embed legal experts on these issues. We learned a lot about the National Guard and how we embed our behavioral behavioral health providers with our Guard units, and how important that was to families. So this is an area that we can do a better job. I'm glad to hear what you said about the Promise Act, and that's something that we have to really take a look at, be sure that's followed through. We can write legislation, but we sometimes can't be sure that it's enacted the way, and there's some very important issues in that. So thank you very much for being here.
Congresswoman, if I may, I wanted to add something about the education and the legal advocates and legal assistance for education issues. I think it's important for the members of the subcommittee and the services to understand that simply assigning a JAG officer to the issue is not going to be sufficient. As you know, it requires somebody who has special expertise in education law, and I think that needs to be kept in mind as we proceed with this. Thank you.
Thank you. And certainly, the special education law in one state can be different from the special education law in another state, and that's why you have to have local attorneys who specialize in special education in that state to really be able to provide expert services. Mr. Cisneros, you're recognized for 5 minutes.
Thank you, Madam Chairwoman, and thank you all for being here today, and especially want to thank our two military spouses for being here, for your sacrifice and the sacrifice of your families for our country. Ms. Norman, you kind of touched on the standardization or the lack of standardization amongst the services, so I kind of want to touch on that. And really, as the military operates now, it's very joint. A lot of cross, you may be on an Army base, you may be on an Air Force base, you may be in another service. And then because there's a lack of standardization, and we'll use your example, you're in the Navy program, when you've gone to these bases, or have you heard stories of families going to different bases and that being in a non-Navy or a non-Army from the branch that they're in? Has there been a lack of service, or has it been harder to get services from the current program of the base that they might be on, the service?
You're absolutely right. It seems to me that more and more there are more duty assignments at joint bases. And if you're a Navy and on an Air Force base, you don't really have anyone to go to for your EFMP concerns. I know we've had many families contact us and let us know that has been a huge challenge for them. Particularly, even we were just talking earlier about respite care program, which is a fantastic program. That's the single reason why we're still in the Navy, which offers 40 hours of respite per month. And a lot of folks are moving to these joint bases where they have no respite care, no one to talk to when they can't get on certain wait lists. It's a huge obstacle for them.
So I think that it's not just respite, it's not just education. EFMP packets that you're at a joint base, they have to be taken to the nearest installation that is your branch. So I know I spoke about, we were at an Air Force base, we had to drive to the nearest National Guard base with the baby in the hospital. Why, if we literally live on the Air Force base and there's an EFMP office there? The same is said when you do transfers. If you're transferring to a joint base, they don't always know you're coming because you're Army and you're transferring to a joint base that's run by the Air Force.
No. So there is no current plan right now for allow you to kind of opt into the current system of the branch or the base or the service that operates the base that you're going to?
No, there's not. So for respite care, for example, the Army has a different program for respite care than the Navy does. So you have to go through the Army for the program the Army uses. We live in D.C. The nearest respite care providers for the Army are in Quantico. So we've not received respite care for any of our 3 children on EFMP since we've been here, and it's been 5 years.
Oh. Yeah, that's horrible. But that just really kind of stipulates really why it's so important that we kind of go and get to one system, so you don't really have to. The fact that you're going to a joint base that may be run by another service, now your child isn't receiving the services that they're entitled to. And so this is really where we need to go. The other area I want to kind of touch on, again, is something that you both have talked about, or really is the career path for the service member, and really kind of putting them, the lack of not being able to go everywhere because services may not be provided, especially going overseas. Has this really affected a negative view amongst the families that you've dealt with and that really kind of caused a negative view of the EFMP program?
So I can say that it absolutely has. And it really comes down to the fact that Joint Base Lewis McChord is a perfect example of a perfect storm. We're sending all of these special needs families there. We're saying there are services there. You have to go there. You can't go somewhere else. And they get there and they're waiting 18 months for care. When your baby's 3 months old, 18 months is a very long time to wait. Mm-hmm. And there's this variability between where you're going to be able to go and where you're not. One family might only have an educational piece, but the education portion of EFMP, all they say is districts are required to provide FAPE. If they're providing a free and appropriate public education, which they're required by law, we can send you there. Nobody's verifying that they actually have the needs that they can meet the needs of the children in the actual IEPs. Nobody reads those parts of the packet. The packet is useless.
And I wanted to address, sir, you were talking about career opportunities in EFMP, and many EFMP families do opt to GAO batch so that their spouses can go and serve their country for a year or 2 years while we stay behind once we have finally found a location that can attempt to meet the needs of your child. There have been instances where I know families will write a letter, a waiver, to the EFMP coordinator saying, I understand that there are no services within 1 hour or within 50 miles of the branch or the base that my spouse is going to be at, but I'm willing to drive an hour and a half. One example would be Newport, Rhode Island. I know that several have written letters to go to the leadership for college there, but also writing a letter saying, I understand, but there's Boston Children's about an hour and a half away. So please, consider this for this next location. But there are many, many EFMP families that are making those sacrifices and taking those burdens, knowing that the next location cannot meet the needs of their family.
Well, I just want to thank you both and all of you for your testimony here today. My time's expired, but thank you again for the service that your family has provided to this country. I yield back.
Do you want to do a second round? Or? Okay. We're not going to do a second round, but Mr. Kelly does have one question. Okay.
And this is specifically to you, Ms. Norman. I mean, does the Navy or do the services pay any separation pay when you choose? Okay, it's not really. You understand what I'm saying, though, or that there's an additional BAH if you're deployed and your family gets for you to stay there when it's career enhancing. Do they have any of those special pays? And if not, would it be helpful if they did?
It would be very helpful.
All right. Ms. Carrig, you indicated that you have no ECHO benefits because the closest provider of those benefits is at Quantico for your service. Is that correct?
No, so respite care, there are two forms of respite care, one through ECHO, one through the community service portion of the armed services. So for us, Army Community Service, EFMP respite care. So the nearest provider for EFMP respite care is through Quantico. And as far as ECHO care, because my child gets in-home nursing care, she doesn't get her ECHO care hours through ECHO. So at this point, it is up to Medicaid to fund those hours, and they do. But if we didn't have Medicaid.
So as a military family, if you had not taken advantage of Medicaid, you would have been paying for the operation and hospitalization out of your own pockets?
The reality is we didn't have the deposit to give them. We had no way to pay them. They suggested we mortgage a house that we didn't have because we've always lived in military housing. I think that that's the most difficult part of this is we know we could have lost our daughter. We had days to come up with the money to pay for a surgery that we didn't have.
And the reason why the military was unwilling to provide the surgery was what?
The way it works when you bring a baby home through adoption is you have to submit a packet through the nearest installation DEER's office. Because we were Army and not Air Force, we had to go to the Army to do that. And when we submitted the packet, it takes some time to process it. So nobody could expedite it. We explained what the situation was, and they said, well, 28 to 45 days, it'll be done. My baby was having surgery in less than 5.
I see. All right. All right. Your testimony has all been very valuable to us. Thank you very much. We'll take a 3-minute recess so that we can change out the panels. Thank you.
Austin, you were awesome. Michelle, love you. Okay.
Thank you for having us today. It means the world to us to have this voice. Thank you. Look forward to the next meeting.
You did the right thing. I was thinking, like, I could answer yes if it's great.
Yeah, I think probably don't want to even fumble around with any of this. Would I?
You have your statement?
I have my statement, yes. Okay, no worries.
It's right behind you, but I might have to sit next to that.
Okay.
It's right there.
I know you have it.
Pleasure to speak with you as well. Thought it was fun. Are you, is Jackie? Yeah. With GAO? Yeah. Hi, I'm Jen Stewart with EFMP. Yes. I remember your name from the, while we were, yeah. You too. Thank you.
It's like they've left all their stuff up. I did it. It's like way better, but like how so impressed. Ryan, are you part of it? Okay. Hi, Michelle. Everyone, if you could take
Air Force. Yes.
Hey, I'm Jen Stewart.
Oh, okay. Okay, well, nice to meet you.
Nice to meet you as well.
Hey. Yeah, I didn't, we had the mock boarding, and you weren't there, so.
Yeah. You guys have had some changes with your EFMP family support.
Yes.
Carla moved
changes.
on. Yeah, that was awesome.
Yes.
Awesome.
It was good to meet you.
Nice to meet you too.
Good afternoon. We'd like to welcome now Ms. Carolyn Stevens, who's the Director, Office of Military Family Readiness Policy at the Department of Defense, Captain Edward Simmer, Chief Clinical Officer, TRICARE Health Plans, Defense Health Agency, Colonel Steve Lewis, U.S. Army Deputy Director, DA Quality of Life Task Force, and DA Family Advocacy Program Manager, Mr. Ed Cannon, Director, Fleet and Family Readiness, Commander, Navy Installation Command, Ms. Norma Inabinet, Deputy Director, Military Personnel Program, Air Force Personnel Center, Ms. Jennifer Stewart, MSW, Manager, Exceptional Family Member Program, Headquarters, U.S. Marine Corps, Ms. Jackie Nowicki, Director, K-12 Education, U.S. Government Accountability Office. Thank you all for being here. Ms. Stevens, you may begin.
Thank you. On behalf of Mr. Matthew Donovan and a cadre of dedicated and expert professionals in personnel and readiness, thank you, Chairwoman Spear, Ranking Member Kelly, and members of the Distinguished Subcommittee for your continued support of our military families and quality of life programs. As a former military spouse, I care about issues impacting our military families, and I'm personally committed to addressing quality of life issues. I appreciate the opportunity to appear before you today to highlight some of the department's efforts in support of our military families and their adult family member or child who is enrolled in the EFMP. Through our many feedback mechanisms, we are aware that service members and spouses have concerns regarding the management and the execution of EFMP. And I want to take a moment to thank the witnesses today for sharing their very personal stories. I want to reaffirm the department's commitment in addressing the challenges that the witnesses have brought forth today. These personal experiences that we hear and the data we collect combine to offer a broader understanding of the challenges facing our military families and help us to better define our courses of action. We can address some of these challenges head-on, while others, such as education and off-installation services, require coordination with our partners and other federal agencies, the states, and local education agencies. We're committed to balancing individual experiences with an evidence-informed strategy and have placed a special focus on the results of recent department-wide surveys and the conclusions of the recent GAO report. I'd like to take a moment to highlight some of the initiatives that were included in my written testimony. We've re-energized the DoD Coordinating Committee for Military Families with Special Needs to ensure a senior executive level oversight. We continue to refine the EFMP data repository, the OSN centralized data collection system. We've developed and implemented a standard EFMP family needs assessment form. The form includes a component which provides for individualized services plans. We developed standardized family member travel screening forms and are working with Health Affairs and the Defense Health Agency to develop and publish policy. And we have engaged with our U.S. Department of Labor land-grant university partners to assist in developing a staffing tool, and we've launched a pilot program that will assist the services in determining adequate staffing levels at each installation. Improving EFMP is a priority for the department. We know we have more work to do. We thank the witnesses for their appearances today and for continuing to advocate for both themselves and for others on this important topic. Thank you again for your continued support of our families. I look forward to your questions.
Next, Mr. Lewis.
Chairwoman Speyer, Ranking Member Kelly, and distinguished members of the subcommittee, thank you for the opportunity to discuss the very important issue of caring for exceptional military family members. At the Defense Health Agency, we are committed to ensuring every military child, and especially those with special needs, receives the health care services they need to reach their maximum potential. We also recognize that family readiness is a key part of service member readiness. As a psychiatrist who has deployed to combat areas, I have seen firsthand the impact that concerns about family members and the care they are receiving can have on service member readiness while deployed. Collaborating with and supporting the service's exceptional family member programs is a very important part of our efforts to ensure family readiness. The DHA works closely with EFMP programs at the installation, service, and DoD levels. DHA support for EFMP and the families we serve includes identifying and evaluating families who qualify for EFMP, providing outstanding medical care and services to eligible family members, including through the Extended Care Health Option, also known as ECHO, and assisting with assignment decisions by providing information about available medical services at potential duty locations worldwide. TRICARE provides a very robust benefit with some of the lowest out-of-pocket costs of any health plan in the country. Our beneficiaries who earn this benefit through their service to the nation deserve nothing less. DHA and our managed care support contractor partners work very hard to ensure our beneficiaries have access to high-value health care and services wherever and whenever they need it. Despite our best efforts, however, we know that we still have room for improvement. Access to care, especially subspecialty care, is challenging in some areas, particularly in remote areas where some of our bases are located. During our first panel today, we heard from families, and I very much appreciate their courage in coming forward and sharing their stories. But they've had significant problems accessing the care they need, and that is unacceptable. We can and should do better. We are committed to addressing these issues and finding effective solutions. Our contractor partners are continuously working to add high-quality providers to the TRICARE network, especially in areas of limited access, and we have expanded access at many military treatment facilities as well. We have also enhanced the telehealth benefit, including covering telehealth into the home to further increase access, and have reduced barriers to receiving mental health care. We also offer a robust medical case management benefit. So thank you again for your continued support for our service members and their families, and I look forward to your questions.
Thank you, Captain Simmer. Now, Colonel Lewis.
Thank you, Chairwoman Spear and Ranking Member Kelly. On behalf of the over 43,000 soldiers who have family members with special needs, we are grateful for your diligent work, support, and focus on the area of the Exceptional Family Member Program. To the families and advocates who testified in the prior panel, thank you for helping us see ourselves and highlighting where we need to improve. The Secretary and the Chief of Staff of the Army established people as the #1 priority, and I am here to attest to their commitment to the Exceptional Family Member Program, one of the most important programs in support of our most valuable asset, our people. As a professional social worker, I've dedicated my nearly 30-year career to helping people in need, especially those most vulnerable and at risk. In my current capacity as the Deputy Director for the Army's Quality of Life Task Force and the Chief of Family Programs, I have the distinct honor to apply my professional knowledge in order to manage critical programs and policy that will improve the well-being of soldiers and families. I am committed to ensuring that special needs family members are the benefactors of the Quality of Life Task Force initiatives and that their equities are represented as we address quality of life. The individuals and teams established to support the Army's Exceptional Family Member Program share a unified purpose: to ensure a soldier's assignment is fully capable of meeting the medical and/or educational needs of the soldier's family member. To achieve this purpose, the EFMP team, consisting of healthcare providers, care coordinators, assignments managers, family support staff, educators, child and youth staff, and the soldier's commander, just to name a few, are charged to work collaboratively with the soldier and his or her family members to achieve the right fit. The Exceptional Family Member Program is the safety net of resources and support for our most vulnerable and at-risk families in order to enhance readiness and promote resilience. However, we know that challenges remain and we have room to improve. We need to make sure that we're effectively connecting and communicating with soldiers and families in order to help them leverage predictable and quality installation and community resources to assist them. We are actively working on solutions to make the enrollment and assignment process more effective and transparent to the soldiers and family members. And finally, we continue to build in processes that include the voice of the soldier and his or her family member as we focus on the Secretary and the Chief of Staff of the Army's People Strategy. I greatly appreciate the opportunity to hear from the committee members and the previous witnesses on how we can improve. We must get this right. In the words of the Chief of Staff of the Army, General McConville, winning matters. The Army wins and our families win when we support the soldiers and families in the Exceptional Family Member Program. And again, thank you for this opportunity. I look forward to your questions.
Thank you, Mr. Cannon.
Chairwoman Spear, Ranking Member Kelly, and distinguished members of this subcommittee, thank you for this opportunity to testify on the Navy's Exceptional Family Member Program. I'd also like to thank the family members who testified before this panel and the family members in the room today. Thank you for being here, for sharing your experiences, and for allowing us to continue the conversation with you to work to better meet your needs. The Navy asks your spouses to be ready to serve and ready to deploy, and we need to continue to do better to ensure that you are supported when your loved ones are called to serve. The Chief of Naval Operations has stated that stronger families make a stronger fleet. I firmly believe Navy's Exceptional Family Member Program plays a critical role in obtaining mission readiness for our sailors. We must ensure our Navy families have the medical and educational resources they need for their exceptional family members. Enrollment in Navy EFM has tripled since 2016, and today we have nearly 23,000 Navy families enrolled. The Navy has 85 full-time personnel supporting our Exceptional Family Member Program. We have increased our outreach to families, expanded training, and increased the resources available to family support staff at Navy installations. In fiscal year 19, Exceptional Family Member Program case liaisons at Navy installations held thousands of private consultations with sailors and family members and offered hundreds of group classes and workshops. Case liaisons also worked with families to develop individual service plans, coordinate non-medical care, work with local school districts, and provide information and referrals for community support resources. While I am proud of our accomplishments, I know we must find ways to improve. We will continue to seek feedback and to listen to the needs of our sailors and their families. This dialogue and the lessons we are learning from our sister services will help us to make changes to the program and improve the support we provide to Navy families. Thank you for your sustained commitment and unwavering support of the Navy's Exceptional Family Member Program. I look forward to your questions.
Thank you, Mr. Cannon. Ms. Inabinet, did I pronounce that right?
Ms. Nabinet, thank you, ma'am. Appreciate it. Chairwoman Spear, Ranking Member Kelly, and distinguished members of the subcommittee, thank you for your continued support of the Armed Services and your interest in the Department of the Air Force's Exceptional Family Member Program. It is an honor to speak to you today on behalf of our air and space professionals and their family. I would also want to thank our family that are witnesses today and appreciate their advocacy for this very important program. Today, we have 33,181 active duty members coded as EFMP sponsors and 50,987 family members that are enrolled in EFMP. The Department of the Air Force Exceptional Family Program is based on a foundation of collaboration, coordination, and care among 3 EFMP components: medical, family support, and assignments. The Department of the Air Force has made strides by reforming EFMP processes and expanding family support capabilities to our EFMP members, and I'd like to take the opportunity to highlight some of those. The following are a few. In November 2019, the Department of the Air Force partnered with CareStarter, a patient-focused IT company that offers mobile app capability to access real-time medical, therapy, and educational information by location. It also offers the capability to create a unique profile for each of our family members by diagnoses and age. The CareStarter program is currently being tested at Travis Air Force Base, California, and we are excited about the possibility of linking CareStarter to our assignment process, as it will provide valuable information to our EFMP families when they are applying for or are selected for any new duty assignments. Since 2017, 59 additional family support coordinator positions were added to our Airmen and Family Readiness Centers. In total, the Air Force has 99 EFMP Force Support Coordinators and 4 program management positions for a grand total of 103 personnel supporting 78 main operating installations and 4 satellite offices for a total of 82 locations. Our coordinators are committed to enhancing the quality of life of our special needs families by providing them assistance and information on community services and developing family assessments, individual plans. The Department of the Air Force also launched a very comprehensive EFMP communication strategy that are consisting of face-to-face and virtual annual and quarterly events. The intent of these events is to inform our EFMP members and families about the available resources, assistances, and processes, but most importantly is to get real-time feedback from our airmen and their families. Our annual EFMP virtual Facebook Live webinar in September of 2019 reached a notable 27,000 participants. The feedback we have received to date has led to numerous process improvements and have provided a more positive experience for our air and space professionals and their families. While the Department of the Air Force has made strides towards enhancing our EFMP program, we know there is still much to be done. Our team of professionals will continue to evaluate our processes and are committed to making changes that will positively impact the quality of life, the well-being, and the readiness of our airmen. Chairwoman Spear, Ranking Member Kelly, and distinguished members of our subcommittee, thank you for your continued advocacy and representation today. We appreciate your support.
Thank you. Ms. Jennifer Stewart, now teach us all what you're doing right in the Marine Corps.
Thank you, ma'am. Chairwoman Spear, Ranking Member Kelly, and distinguished members of the subcommittee, on behalf of your Marine Corps, I would like to thank you for inviting me here today to discuss our Exceptional Family Member Program. We are grateful for your continued active engagement in making lasting improvements to the overall health, well-being, and quality of life for Marines and their families. I want to thank you for holding this hearing, the Family Caucus in October, and the more informal briefing last month. These events have put vital focus on the EFMP, both the things we do well and the things we can improve upon. I appreciate the families who have bravely shared their personal stories today in an effort to effect change. They've shared the challenges they face with transferring and establishing medical care and educational plans, receiving consistent support from EFMP staff, and managing the demands of career and family while advocating and caring for a family member with a disability. While we will never be able to remove all the challenges and stresses, we must continue to strive to do what we can to alleviate them. Customer and stakeholder engagement and input has been and will continue to be a key element of your Marine Corps EFMP. Customer feedback was central to the transformative changes we made in 2007. Assessing customer satisfaction with our program in 2013 and 2015, and most recently, a vital element of our 2019 program evaluation effort. We are committed to evaluating the effectiveness of our program and making necessary changes when evaluation indicates we have missed the mark. A 2017 study analyzed the career progression of more than 20,000 EFMP enrolled Marines compared to their non-enrolled peers over the course of 25 years. It found that EFMP enrollment does not negatively impact career progression in the aggregate. Marines enrolled in EFMP remain in service slightly longer than and achieve the same rank as their non-enrolled peers, and they achieve this highest grade in the same or shorter amount of time as the average of their non-enrolled peers. We are looking forward to the results of a comprehensive FY19 program evaluation of EFMP that included, among other things, a customer needs assessment, customer and staff satisfaction survey, staffing model review, and validation of our measures of performance and effectiveness. We anticipate the results in the spring of this year. Taking care of Marines and their families is a key element of overall readiness and combat effectiveness. The adage, we recruit Marines, we retain families, is as true today as ever. Our EFMP has come a long way since its inception. We realize that with our success stories are other stories of continued challenge and stress. We must continue to work hard to help those who feel the program has not done all it can. By ensuring that we take care of EFMP enrolled Marines and their families, we fulfill our responsibility to keep faith with the honor, courage, and commitment they have so freely given. Thank you for the opportunity to present this statement on this important topic, and I'm happy to answer any questions you may have.
Thank you, Ms. Stewart. Ms. Nowicki.
Good afternoon, Chairwoman Spear, Ranking Member Kelly, and members of the subcommittee. Thank you for inviting me here today to discuss GAO's work on DoD's Exceptional Family Member Program. As we have heard, military families with special needs face unique challenges, which are complicated by frequent moves. and families are often frustrated by a program that is intended to help them but does not always meet their needs. In May 2018, we made 3 recommendations to remedy significant weaknesses with OSN's oversight of the EFM programs. DoD agreed with all of them. My statement today focuses on the 2 main types of challenges we identified and the status of DoD's efforts to address them. First, we found wide variation, as you know, in EFM programming among the services, which could lead to gaps in assistance. For example, only the Marine Corps specified a minimum frequency with which EFM families should be contacted by their family support providers. The Air Force and Army did not have requirements for regular contact, and the Navy only required contact for certain families. The Marine Corps, as you know, was only the service to employ special education attorneys, which may have particular implications for families who believe their children are not receiving special education services outlined in their IEPs or who are having difficulty obtaining an IEP. Special education is often an area of great frustration when families move from state to state, as the federal special education law gives states a fair amount of flexibility to determine eligibility for services and define disability categories, meaning a child could be eligible for services in one state but not in another, even with no change in diagnoses. Officials from the other branches told us that they've found other ways to try and help families who are seeking special education legal advice. For example, they might connect families to outside organizations that provide specialized legal support, though often at the family's expense. Or they might refer them to general military lawyers, though these attorneys may lack expertise in special education law. At the time we did our work, we also found that the Air Force EFM program did not include a training component for EFM families, and neither the Air Force nor the Navy provided family support relocation services to EFM families, both of which are required by DoD policy. Further, although services plans are used to document the services and support each family needs and are required, we found that there are tens of thousands of military families who lack them. In April 2017, DoD directed the services to allocate sufficient funds and resources, including staffing, needed to achieve DoD's policy objectives for the EFM programs. However, DoD has not provided guidance nor developed a standard as to what sufficient funding and resources look like, relying instead on each service to determine this for themselves. As a result of these types of shortcomings, we concluded that some families with special needs may not get the assistance they require, particularly when relocating. We recommended that DoD assess the extent to which each military service provides sufficient funding and resources for their programs and the extent to which service plans are being developed, and that DoD include this information in a gap analysis in its annual report to Congress on EFMP. DoD has made only limited progress implementing this recommendation because, for example, it only began collecting data on services plans in the last quarter of 2019. Regarding staffing and funding, DoD officials told us last April that they were piloting a staffing tool to help determine the number of family support providers needed at each installation, and they expected the pilot to last for 2 years. The second group of challenges we identified broadly relates to OSN's oversight of the EFM programs. For example, we found that DoD lacked a common set of performance measures for EFM programs and is therefore unable to fully assess the effectiveness of assignment coordination and family support at each installation. DoD officials told us that past efforts to create these types of measures have been unsuccessful because the services cannot agree on what these measures should be. OSN also lacks a process to systematically monitor the EFM programs and instead relies on each service to self-monitor. As of January, our recommendations to develop these performance measures and develop a systematic monitoring process remain unaddressed, and DoD remains unable to determine the adequacy of the services EFM programs as required by federal law. In conclusion, developing a policy for families with special needs that works across DoD's 4 military services is challenging, given DoD's size and complexity and mission. But the lack of direction from DoD on how to provide EFM services or what the scope of those services should be means that some service members get more or less from the EFM every time they relocate, making an already stressful situation worse. And until DoD is able to assess EFM performance across all its services, it will not be able to ensure that military families with special needs receive adequate, consistent, reliable support no matter where they are stationed. This completes my prepared remarks, and I look forward to responding to any questions you may have.
Thank you, Ms. Nowicki. So at the outset, let me say this. I find the GAO report to be stinging in terms of its criticism of many of the services. And it's not good enough to come here and make happy talk about how you want to be helpful and how grateful you are for the courage of these parents to come forward and speak about their experiences. It reminds me a whole lot about the many hearings we had on sexual assault in the military and how every service official who came said they had zero tolerance for it, but it continues. So I'm telling you at the outset that we're going to be hawks on this. And we're going to have all of you come back every 3 months to give us a briefing on whether or not you have met the specific requirements that GAO has asked you to do until you get it done. Because it sounds like it's not happening. So let me start with this chart that's in our, let me ask you first this question. Have any of you read the statements of the 2 parents that testified today? Just raise your hands. Only 2 of you.
Sorry.
No, you have not. Okay, for your homework, I would like for each of you to read their statements, because within their statements, particularly Ms. Carrick's, are numerous vignettes about other service member families and what they have dealt with. I don't think there is a true appreciation of what these families are going through. We have another room filled with families here. We have an overflow crowd of families who came today, none of whom are testifying, but all of whom have issues with the EMFP program. So the chart we have shows that the Marine Corps has 107 full-time equivalent family support staff. It's one of the smallest branches, as 107. How many does the Navy have? 71. How much does the Army have? 119. And yet you have many-fold more service members and many-fold more family members who are enrolled. In fact, in the Marine Corps, they have 107 full-time equivalent family support staff for 11,000 families. The Army has 119 family support for 54,000 families. So there should be no question in anyone's mind that the services the families in the Army are receiving are not adequate. So I guess my first question is, Ms. Stewart mentioned that they were doing satisfaction surveys within the Marine Corps of the EMFP program. Have any of the other services done that?
Chairwoman Spear, for the Army, I would like to say, back in February of last year, Secretary of the Army Esper at the time was very concerned about the EFMP program, and he directed that the Army conduct a comprehensive survey of the families in the enrolled in the EFMP program. We reached out to over 21,000 family members enrolled in the EFMP program, received back 3,000 surveys, which allowed us again to identify very similar findings that were both in the GAO report, but also what was described today, that we still have gaps and vulnerabilities in the program.
So what is your game plan to address those gaps? I mean, if you only have 119 family support staff for 54,000 families, you need to add like 400 to meet what the Marines are doing for their families.
The survey did allow us an opportunity to recognize that we do have challenges in reaching out and engaging and communicating with families to ensure that they know what family support services are available. The staffing for the EFMP program, we do use utilization data as well as enrollment trends that help us to identify the staffing available previously.
Ms. Stevens, you said that you have re-energized this advisory panel, but to my knowledge, there aren't any parents that serve on them, are there?
There are no parents on the coordinated committee. We do, however, have a family advisory panel made up of 7 family members nominated by the service. We meet with them on a quarterly basis. That's where our families come into play.
Why wouldn't you have family members serving on this advisory panel?
So the advisory panel that I referenced, the coordinated committee, for special needs is designed to bring together health affairs, our general counsel, representatives from the military departments, where we're talking through some of the very processes we've discussed, with a particular focus this past year on standardization. So we're looking for leadership from the military service level and those organizations.
You know, that was a lot of alphabet soup to me. I mean, if in fact you've got programs that aren't working for the families, wouldn't it behoove you to bring the family members in to find out what their needs are?
We do rely on the Family Advisory Panel for one means of getting information from the family. In the next couple of months, we'll be launching a family feedback tool which will allow us to get much more current feedback from families as they access family support systems.
All right. Thank you. My time's expired. Mr. Kelly.
I'm going to do more talking than I am listening, and that's against my better judgment and what I know is not. But number one is, if it was easy or if it wasn't hard, somebody'd already be doing it. So you guys are executives. You get paid to do hard things. You get paid to make decisions that makes people's lives better. So I want to start with, number one, I heard a whole lot of talking about processes. We're not talking about processes or however you correctly enunciate and pronounce that. What we're talking about is people. People. And we're talking about those very most vulnerable people that we should be helping. We shouldn't make it harder. We got to make it easier. And so I ask each and every one of you, and each and one of you should ask yourself every single day, what have I done today that made their life better? What have I done today that made those kids or family members or that soldier or that sailor, what have I done that made it better today? Because I can guarantee you, every one of you can find one simple thing every day you can do. And we're not doing that because we're talking about processes. We're not talking about people. But if it's your people, we talk about it. The second thing, and I do want to answer, just when was the last time you met with an EFMP family that you did not know, and how often do you do that? How often have you done that in the last 3 months? When's the last time you met with a EFMP family in their place and met with them and see what their issues are, and how often do you do that?
Sir, I have not personally met with an EFMP family in the last 3 months. My staff.
That's good.
Thank you.
I have met with an EFMP family about a month ago, sir.
Okay.
Sir, I have not met with an EFMP family in the last 3 months.
Sir, I have not met with an EFMP family member in the last 3 months.
Sir, I have met with an EFMP family within the last week.
I've met with families in the last week, and I talk to families every day on the phone.
And you're opted out because that's not part of your job. I have a harder question for you. No, and I don't do that. We so often get at high levels, we got to walk around. You've got to talk to the people that it's impacted. And you've got to make it personal. And if it's not personal, we're not going to get the right results. Because every one of these people are people, and we can all do things. You guys have amazing power in your jobs. You have amazing power. And we let all this bureaucracy make the decisions that you're allowed to make. And if you have the authority, take it and use it for good. Use it to help those families. And if you don't have the authority, you ask me and Chairwoman Spear, and I promise you, we may not get it, but we're going to bust our tail trying. That's how important this is to us. General McConville says, people first, winning matters, and Army strong. I will tell you, people first. You can't take care of people if you're not taking care of their family. And I know that General McConville agrees with that. I know at his level, winning matters. It matters to readiness that these warriors are able to go down range without worrying about what they do. So winning matters, and that means winning with their family. That means for you, in my opinion, and I won't quote General McConville, but what that means is the little things I was talking about, winning every day to make those service members' lives better. Winning every single day, even if it's a small thing, win every single day. Measure winning. And the final thing is Army strong. Strong families equal a strong Army. And my dad, the smartest guy I ever knew with a high school education, used to say, we do well the things that we measure. If we don't measure, if we don't have things that show, if we're not doing what the GAO says, if we don't have our own parameters and criteria and things that we intend to meet, we're not going to get better. You've got to measure it or you won't do it better. You've got to be able to articulate the measurement of what makes us better. Oh my goodness, I'm just on. And let me just tell y'all a few things that I think you can do. Number one is, let's either get the authorities with TRICARE that when someone is ready to move, when they get their notification that they're moving to a PCS, they immediately get enrolled in the waiting list. Immediately. That's easy. So just tell us what you need from us to make it happen. Travel, we had the thing at JBLM where they're 50 miles, but you got to get on a ferry and everything else, so we can't pay it. Holy cow, surely a two-star general or a one-star general somewhere can write that and say, you're an exception and we're going to pay your travel for this. Surely we can do that when it takes a half a day to get there and a half a day to get back, but it's not in the 50 miles. I'm sorry, I'm going to go just a little over, Chairwoman. I'm going. BAH and separation pay, you heard me say that today. Holy cow. I mean, surely at the two-star level, we can say if a person chooses a promotion assignment and they're separated from their family, we're going to give them separation or the additional BAH. Those are easy fixes. And I think there's one more, but I'm going to leave it with that. And Ms. Nowicki, if you would just tell us how to get somebody else engaged so we can, like the Marine Corps, but these school systems should be compliant, and I would really appreciate any thoughts you have after the hearing on that. Thank you, Chairwoman, and I yield back.
All right, Ms. Holland.
Thank you, thank you, Chairwoman, and thank you to the panelists and the families for being here today and for sharing your concerns and ideas on how we can improve the care for our EFMP families. As some of you may know, my father served in the Marines for 30 years. Having been raised in a military family, I'm deeply interested in how we care for our military members and their families. In my district, I have 475 EFMP families. While many families have expressed appreciation for the Airmen Family and Readiness Center, they've also shared their frustrations with other aspects of the program. They can quickly access forms and get them processed, but they struggle to find someone knowledgeable enough to help them navigate all the resources and the related educational and medical system. One family who's been in the military for 17 years was recently surprised to learn they are eligible for a service dog. They learned this through their own research, not from help of anybody. Another constituent equated navigating through EFMP to learning a foreign language. So I want to just put this question out there, and whoever would like to answer it, I think it's important for all of you, but who is responsible for ensuring EFMP families understand the benefits and resources available to them? And what steps do you propose the DoD take to resolve this gap in information and comprehensive care? Ms. Stevens?
Thank you for that question. I'd like to start with the who is responsible piece, if I may. Mm-hmm. We recognize that our families have an overload of information at times, and it's very hard to know where to look and who to turn to. And one of the initiatives that we have in place that's ready to launch in about 2 months is something called EFMP and Me. EFMP and Me is a web application that allows a family to drill down in subject areas that are either of interest to them or for which they may need particular services. The purpose behind EFMP is to help remove the noise of too much information, provide checklists that can help a family determine the kinds of questions they need to be asking, point them in a direction for individuals who can help them with some of their questions. Regarding your question about medical care, I will have to defer.
So I think for medical care, ma'am, it's very important that we provide a number of different sources of information, make sure that information is reliable, accurate, and at a level that the families can use. I think we have a number of ways that we do that currently. Our contractors have educators being located on major bases to teach them about the TRICARE benefit and their health benefit. All of our military treatment facilities provide education to our beneficiaries as well. We also have 2 projects that we're launching now. One is the TRICARE Select Navigator program, thanks to this committee, where we are going to have navigators for where we will have navigators for our TRICARE Select patients with complex medical problems and their families, who will help them find the right care, find the best quality care, and help them understand what the out-of-pocket costs will be in advance. So that's a very important program for us that we're rolling out. We also work very closely with, as I mentioned previously, our medical case management program. Those folks help our patients understand where to get care. They help with transfers of care when they move from one location to another, and make sure that they know what benefits are available for their family member and get them the help that they need.
Thank you so much. I want to move on to another question in the interest of time. I understand that with EFMP, there are several tiers of severe and non-severe disabilities that address educational and physical needs, but I've heard from families that their child's conditions are not adequately being assessed and that many military families are being left behind. They've expressed challenges in finding appropriate care and resources for conditions that are not even listed with EFMP, causing them to miss time at school and creating unacceptably high out-of-pocket medical costs. For example, the limited pain management in some families not enrolled in EFMP has led to emotional distress and even depression in some patients. How does TRICARE and the services assess what conditions should not be considered and diagnosed as debilitating within EFMP? And Mr. Simmer, I guess you would be best to answer that as well.
So I can certainly answer for the medical part of that. Our providers, especially those in the military treatment facilities, are familiar with which conditions may be limiting, which conditions should be referred for potential enrollment in the EFMP program. They work with families to identify the level of severity and help the family determine should we apply for EFMP or not. In the end, the family makes that decision, but certainly our providers can help the families understand the level of severity and the potential implications of that condition in the family's future.
Thank you. Chairwoman, I yield.
Thank you, Ms. Holland. I think you've heard from a number of us today about our dissatisfaction with what we've heard. I can just state for myself that we are going to fix this year. And we're going to start off with town halls so that all the people that came here today are going to have an opportunity to tell us what their experiences are. And I'm going to ask each of you to come to those town halls. They may be in the evenings when people can get off work. And we're going to find out the gravity of this issue service by service. And I would say to you, Ms. Stevens, that we could solve a lot of our problems if we just take the Marine Corps' model and implement it in every one of the services. That would be a really good first start because they obviously get it. And the GAO has made it crystal clear that part of what is successful is when you have contact with the families. And in the Marine Corps, they have contacts, did you say monthly?
Sorry, Chairwoman, they specify a level of contact that they're supposed to have, but do you know how? Quarterly contact.
Quarterly. And if I recall correctly in your report, in one or two of the services, there may be no contact the entire year. So we're going to change the system so it's responsive to the families because words don't have any weight unless they are followed up with actions. And you can all say that we're here for the families, but unless we're going to show it by action, we are not achieving that result. And these families deserve so much more. They are struggling not just with being military families and the normal course of being moved every 3 or 4 years or having spouses that are away from them or all the other trials and tribulations. They also have kids with special needs. And we've got to recognize there's a high propensity for that in the military, evidently, and we've got to address it. It's going to take resources, but there's lots of ways that we can provide those resources and take them from other less significant needs in the federal government. So that's my commitment to all the families that are here. And I'm going to have Ms. Nowicki become my best friend over the next few months, and I'm sure that Mr. Kelly will as well, because we're going to make sure that she can be able to come back to us in short order and say that all of the services have followed through on all the recommendations. So with that, we stand adjourned.
I'm sure we'll chat again.
I know.
Every 3 months, it's going to be especially for you. I just want to It's frustrating just being a shop.
Do you have mine?